Hello, friends. Welcome back to a very special session of 3-day APAC HealthTech Innovation Conclave. We are joined by a special guest, Mr. Rustom, lawyer, co-founder, and CEO, Augnito. We welcome Mr. Rustom. Thanks for joining us.
Thank you very much.
Before we start your special presentation on the technological innovation, especially led with AI, I guess, let me inform you and also our August gathering that since morning we had 2 to 3 sessions. The first, we had the inaugural session, which we saw the presence of Honorable Health Minister of Chhattisgarh, Mr. T.S. Deo, present there. We had two policymakers from the two states of Kerala and Haryana. Also, we had four AIMS director with us, AIMS Bhatinda, AIMS Delhi, AIMS Bhopal, and AIMS Raipur. And also, we are joined by DGNIC, Dr. Neeta Verma, as well. After that, we had a special presentation by Dell Technology, then had a panel discussion on virtual care deployment for accelerating today's healthcare environment, in which we saw presence of CIOs from Akash Healthcare, Sankar Nethralaya Medical Research, CK Birla Hospitals, KIMS Hospital, Excel Hospital, and Digital Health uh, Consultant also were present in that session. But now we have come to a very important part of this 3-day conclave. We have a technology presentation by Mr. Rustom, lawyer, co-founder, and CEO. Over to you, Mr. Rustom. Let's see what kind of innovation being done by Augnito. Over to you.
Thank you very much. Great. So, hi everyone. Could we just get it in presentation mode? Hi everyone. I'm Rustom, lawyer, CEO and co-founder at Augnito, and it really is a great pleasure to be presenting to this esteemed audience at the APAC Healthcare Conference. You'll be excited to see how artificial intelligence-based speech recognition, or rather powered speech recognition, can dramatically improve data capture for your clinical systems like your EMRs and HISs, and also really improve the experience for the doctor, who's the person who's actually inputting into these systems. So that's what my presentation is going to be about, and I'll talk to you a little bit about our company first. Yeah, you can go next. Yeah, so our company's name is actually ScribeTech. Could you do next? Yeah, and you can do this whole page, please. Next. Yeah, so we're actually a 2-decade-old company, and we really pioneered medical transcription in the UK NHS. And, this really sort of brought together. Could you go next, please? Yeah. So this 2 decades of medical transcription was really the sort of spine of building this artificial intelligence engine, which is a speech recognition engine, first of its type kind in India. And it's actually a product that's trusted by many leading hospital groups, as you can see. And it's a technology that can be used across all platforms, whether mobile, tablet, web, or on your computer. Thanks. Next, please. So I'm going to give you just a short sort of presentation, a little video, which will show you how Augnito works in our demo EMR system. Thanks.
Augnito can voice power your HIS, EMR, or RIS. Let me demonstrate this with a simple demo EMR that we have developed. Referral source, GP. Height, 167 centimeters. Pulse rate, 98 beats per minute. Chief complaints. Chronic pain, full stop, next line. Seronegative inflammatory arthritis, full stop, next line. Abdominal pain and nausea, full stop, next line. Family history of psoriatic arthritis, full stop. Diagnosis. Psoriatic arthritis, full stop, next line. Psoriasis, full stop, next line. Gastroesophageal reflux disease, full stop, next line. Dyspepsia, full stop. Visit outcome, discharge. Medications. Methotrexate 15 milligrams once weekly for 5 weeks. Next line. Omeprazole 20 milligrams twice daily for 1 week. Next line. Hydroxychloroquine 200 milligrams once daily for 2 weeks. Next line. simvastatin 80 milligrams twice a day for 6 days. Next line. Levothyroxine 75 micrograms morning dose once a day for 7 days. Next line. This is how intelligently Augnito can voice power your HIS, EMR, or R.
Next, please.
Augnito can voice power your HIS.
Next slide. Yeah, so as you could see, that was actually just a quick demonstration of a very simple demo EMR system. And our API SDK can integrate into any clinical system, be it HIS, EMR, RIS, LIS system, right? So what we've actually built, could you show the next one, please? Yeah, so what we've actually built here is really one of the most powerful voice recognition engines globally. So, when you think of a voice recognition engine, some of these names, mainly out of America, do come up. But, I'm really proud to say that, Augnito is the first powerful clinical voice recognition engine that's built right here in India. So, really proud of that. And, we're already sort of integrating into many healthcare systems across the country and beyond, actually. So could we go next? So I really wanted to sort of talk about, the opportunities here in APAC and why it's so important. Clearly, this region has very low doctor-patient and nurse-to-patient ratios. Next. You can put up the next 3. Yeah. Clearly there's a lot of language diversity. Just in India itself, we've got 22 regional languages. And I think, this region seems to be extremely open to new innovation. So reports have shown that 50% of people would adopt digital delivery models, which is great. And the region has 40% of the growth in global healthcare spending. So, you're literally talking about a rate that's almost double that of the rest of the world. So this is really where the action is, and it's just great to be involved, in this innovative area in the region. Next slide, please. Yeah, you can just bring up the slide. Yeah. So the voice user interface, what we like to call the WUI, right? If you think about it, it's like in the 1970s, there was the new graphical user interface which has come up. Some people would call the GUI. Right, and this actually revolutionized software and the entire home computer market. Actually, it was Steve Jobs who saw this at when it had come out, and he took this technology and understood its potential to create the whole home computer revolution. So we see this big leap happening in the virtual assistant market. So why is this such a powerful technology? Firstly, there's really no learning curve. Very easy, 4 times faster than typing. And you actually completely eliminate spelling mistakes because we have the entire language of medicine available in it. And today, it's really contactless reporting. So, if you're a surgeon and you want to give a voice command to a computer or put your notes in while you're doing your surgery, it's today possible with this type of technology. Yeah, next, please. Yeah, so of course, for patients, you receive much more detailed and accurate reports. And of course, a lot of our studies have shown that, a large hospital group, if they actually go and make it a sort of voice first hospital, you have the potential to actually add close to 40 crores just on your bottom line. So this is the power of actually being able to speak to a computer rather than having to type inside it. Next slide, please. And sorry, just if you can go back. The other point I think which is very important is that, at the end of the day, anything to do with artificial intelligence, you need good quality data, right? And this actually improves, your data entry into these systems so that you're able to structure, do much better analytics, right? And you can sort of develop your own research out of this. Thanks. Next slide, please. Yeah. So I want to sort of open your eyes a little more to some other areas that voice is actually very powerful on, and this is the new and emerging area of voice diagnostics, right? So this is just for your information. I thought it'll be an interesting thing to actually present to people, that there's a concept of a voice biomarker. Now, a voice biomarker is nothing other than, say, for example, if you had actually gone on to onto a work trip, and after a long day's work, you call your mother at home and you're like, hey mom, just had a long day or whatever. Your mother would be able to very, very easily work out that you're stressed, for example. That is simply a voice biomarker, because she's heard your voice over many years. So today, AI is becoming very, very good at this. And as you can see, some of the examples is early signs of Alzheimer's disease, picking up asthma, pulmonary hypertension, and even mental health and emotional well-being. So one of the use cases is in mental health, that you'd be able to pick up if someone is depressed, or if someone was actually suicidal, just from the sound of their voice. Now you can imagine, in a country like India, where you've got over 1 billion people, imagine having a technology that can scale just from the smartphone to so many people. Thanks. You can go to the next. Yeah. So another emerging area is being able to actually detect COVID just through the sound of your voice, right? So the Indian Institute of Science actually is working on an algorithm called Koswara, where they've actually, you can show the whole slide, please. Yeah, where they've actually shown and taken breathing and cough and voice sounds, and being able to, from that, train neural networks to be able to actually actually detect if someone has COVID. And sorry, can you go back? Yeah, there's a study out of Israel, a recent one in Feb 2021, where it's actually showing 80% accuracy for detecting COVID. So unbelievably scalable and unbelievably powerful technology. Yeah, next slide, please. So I want to spend a little bit of time around this this actual slide. So as you can see, there are two S curves right there. Now, the first one is the United States, with showing how sort of mobile penetration had grown in the country, and the other one showing India. Now you can see, since the 1960s, huge infrastructure had gone into fixed phone lines that were needed. But whereas in India, where that infrastructure was not put in, we sort of jumped directly and were able to take a leap directly into the mobile age. Now, I believe, and a lot of people believe, that we're at this type of time with AI in healthcare, right? And an example of this, which I feel is quite contemporary, is if you look at there were a few companies during the COVID crisis which had algorithms which could actually detect if someone had COVID in X-rays, and they're tied up with the Bombay Municipal Corporation. And that type of triaging had actually really made the whole process a lot more efficient. So AI can really come in and make the difference, and give you that big leap in the same way as it had happened with mobile. So very, very exciting time to be in this space. Yeah, next slide, please. So I just want to end with a little bit about something that's come out of our R&D lab. My apologies to our international friends who may not know Hindi, but this is an example of some R&D that we're working on, where you can see medical speech recognition happening in Hindi. So please go ahead.
खुद को दूसरों से अलग
Sorry, play the video, please.
आपको हल्के कोरोना के लक्षण दिखाई दे रहे हैं। खुद को दूसरों से अलग करें और पास के स्वास्थ्य केंद्र में आरटीपीसीआर टेस्ट और सीटी स्कैन के लिए जाएं। भोजन के बाद दिन में 2 बार हाइड्रोक्सीक्लोरोक्विन टैबलेट और डोलो टैबलेट लेना शुरू करें। कॉपलेट सिरप भी ले सकते हो। नमक के पानी के गरारे करें और दिन में ज्यादातर गर्म पानी पिए।
Next slide, please. So thank you very much. Really a great opportunity to be presenting at this conference. And if you want to transform your documentation process, please be in touch at sales@augnito.ai. Thank you very much.
Thank you so much. Thank you so much, Mr. Rustom, lawyer, co-founder and CEO of Augnito. You talked about your solution on voice-based AI, and that is the future, no doubt about it. In fact, in the inaugural, most of the speakers who are part of AIMS or be it government ecosystem, they were all talking about how artificial intelligence is going to be the game changer for transforming India's healthcare ecosystem, especially keeping in mind the new normal in which we all are living in. Thank you so much, Mr. Rustom, lawyer. I'm sure that the solution being leveraged by your company, your Augnito, there will be many speakers who are already present for the next session. They will be interested to talk to you off the record, and also the August audience who are present here will be interested to know more about Augnito. I'm sure this event will help, because the aim of this event has been to bring the best of the minds together, be it from government, be it from industry, so that communication happens, that collaboration opportunities can be explored. Thank you so much, Mr. Rustom. Do keep in touch.
Thanks very much. Thank
With
you.
this,
Thanks for the platform.